Hi everyone. So today in diabetes series, I will discuss about fifth type of diabetes, that is the latent autoimmune diabetes of adult. So ये एक autoimmune disease है जो adulthood में start होती है, जिसमें इंसुलिन की जरूरत नहीं होती ग्लूकोज कंट्रोल करने के लिए during the first 6 months after the diagnosis. ये एक जेनेटिक, इम्यूनोलॉजिक और मेटाबॉलिक फीचर टाइप 1 एंड टाइप 2 डायबिटीज मेलाइटस के साथ शो करता है और बाय मिस्टेक यूजुअली इट इज डायग्नोज्ड एज टाइप 2 डायबिटीज मेलाइटस। इसीलिए इसको टाइप 1.5 डायबिटीज मेलाइटस भी कहा जाता है बिकॉज इट शोज द कैरेक्टरिस्टिक्स ऑफ बोथ टाइप 1 एंड टाइप 2 डायबिटीज मेलाइटस। Since several unknown factors cause latent autoimmune disease of adults, lifestyle change is one factor to prevent it. लाइफ चेंज में क्या होगा, लाइफ स्टाइल चेंज का में क्या करना होगा, दैट इज एक्सरसाइज, जो हमने पहले वीडियोस में डिस्कस किया है, एवरेज अबाउट 30 minutes of exercise. Who defines latent autoimmune diabetes of adults as a slow evolving immune related diabetes? Or the Immunology for Diabetic Society has specified three characteristics or three criteria for the diagnosis of latent autoimmune diabetes of adults, जिसमें age greater than 30 years, positive autoantibodies to isolate beta cell, insulin dependence for at least the initial 6 months after initial diagnosis. So insulin की जरूरत नहीं होती for about 6 months after the diagnosis of LADA, that is latent autoimmune diabetes of adults. LADA has low autoantibody titer against beta cell compared to type 1 diabetes mellitus. Destruction progress is slow in case of latent autoimmune diabetes mellitus. However, some patients have high antibody titer and low body mass index and progress faster for insulin therapy, which one with low antibody titers. Increased body mass index progresses slowly towards the insulin therapy. The risk of acquiring LADA is highest in carriers of HLA halotypes. HLA gene encodes for the major histocompatibility complex antigens with important immunoregulatory functions. Therefore, it is unsurprising that LADA is caused by dysregulated immunity. Epidemiology. So latent autoimmune disease जो है, it is the most frequent form of adult onset autoimmune diabetes mellitus. Most patients with LADA are positive for a single islet autoantibody. Glutamic acid decarboxylase antibody is most predominant. Coming to pathophysiology, so islet beta cells autoantibody marks the onset of latent autoimmune diabetes of adults, followed by insulin resistance, which in turn cause hyperglycemia, that is, it is insulin dependent diabetes mellitus. So जैसे पहले बोला था, LADA has similar characteristics of both, that is type 1 and type 2 diabetes mellitus. So जो type 1 diabetes mellitus से ये सिमिलर है, उसका कैरेक्टर है इट डिस्ट्रॉयज बीटा सेल। जैसे टाइप 1 डायबिटीज मेलाइटिस में बीटा सेल का डिस्ट्रक्शन होता है, वैसे ही इसमें भी, दैट इज LADA में भी बीटा सेल का डिस्ट्रक्शन होगा। और जैसे टाइप 2 डायबिटीज मेलाइटिस में इंसुलिन रेजिस्टेंस हो जाता है, दैट इज सेल्स This receptor of the cell do not take insulin inside the cell or recognize insulin as a signal for metabolism of glucose. वैसे ही LADA में भी cells recognize नहीं करते इंसुलिन को as a signal. Thus, pathophysiology of LADA involves both autoimmunity as well as metabolic derangement of insulin resistant. Autoimmunity कैसे, जैसे जब अपना बीटा सेल्स डिस्ट्रक्शन होता है, एंड मेटाबॉलिक डिरेंजमेंट जैसे इंसुलिन रेजिस्टेंस हो जाता है. A study analyzed pancreatic tissues from humans and rat models mimicking LADA were analyzed by using immunohistochemistry and PCR. Macrophage infiltration was shown in the islet cells as opposed to type 1 diabetes mellitus, which showed CD8 lymphocyte. Islet group exists with and without infiltration. The result was increase in beta cell gene transcription factor, greater C-peptide levels, which is a part of insulin precursor. Usually insulin in its initial stage has three peptides, that is A, B and C, joined together. In mature insulin, active form A and B peptides are present while the middle fragment C fragment is removed. And slower onset of LADA compared to type 1 diabetes mellitus. Genetic loci common in type 1 diabetes mellitus are linked to LADA, like MHC complex gene, TPN22, protein tyrosine phosphatase, non-receptor type 22 that helps regulate T cell activation and signaling, SH2B3. Adapter protein play important role in insulin signaling pathway, and INS helps in creating insulin, gives genetic instruction for creating insulin. Positive correlation exists in patient with LADA with BM1, that is body mass index, and interleukin 17, a pro-inflammatory cytokine from peripheral beta lymphocytes implicated in type 2 diabetes mellitus and obesity. Evaluation and recommended tests for confirming latent autoimmune diabetes for adults. When adult patient present with hyperglycemia with or without symptoms and is controlled without the need of insulin in the first 6 months, LADA is confirmed. A positive antibody to one of the islet antigen is the hallmark of LADA. Worldwide, the most prevalent islet autoantibody utilized is GADA. Others include IA2A insulin antibodies, zinc transporters, isoform 8 antibody that occurs with varying frequency. So recommended test जो कंफर्म करेगी हमारा लेडे को, that is the fasting glucose and glycosylated hemoglobin का measurement, self monitoring of blood glucose, lipid profiling, estimated glomerular filtration rate, serum creatine, measurement of glycemic variability, test of neuropathies, retinopathy. Other tests may be prescribed with the complications of the individuals. Treatment and management. The diagnosis of LADA is made. Once the diagnosis of LADA is made, non-pharmacologic therapy including medical, nutrition, exercise plan similar to those employed in type 1 and type 2 diabetes is provided. Since LADA is a heterogeneous condition, pharmacological treatment should be personalized to gain the maximum advantage of the therapy. The two goals of pharmacological treatment is to obtain good glycemic control and to prevent or delay complications. Insulin is required in most of the patient. Study results have shown preserved beta cell, a stimulated C-peptide response, normal hemoglobin acetylated levels, and decreased autoantibody concentration. Thiazolidones improve insulin sensitivity by activating nuclear peroxisome proliferator activated receptor gamma receptors, which will in turn make the cells sensitive. Limited data is available with respect to the latter. Prognosis: Patients with LADA have mortality as high as type 2 diabetes mellitus. In the Trondheim health study, hyperglycemia was the only significant influencing factor, not the other components of metabolic syndrome, in determining mortality due to cardiac diseases. Compared to those of type 2 diabetes mellitus, patients with LADA have a lower rate of microvascular complications at the time of diagnosis, but an increased risk during long-term follow-up. The small fiber neuropathy, जिसका मतलब है peripheral nerve condition that damages small nerve fiber, cause pain and autoimmune issue, occurs early and with increased frequency in LADA when compared to type 2 diabetes mellitus, which is related to higher acetylated hemoglobin and poor glycemic control. Long-term follow-up of patient with LADA reveals lower risk in first 9 years, but a higher risk of complications, microvascular complication in later years. Compared to type 2 diabetes, patients with LADA have a similar degree of carotid artery atherosclerosis, that is blockage of artery with cholesterol and fat, as type 1 and type 2 diabetes, though a better through a better vascular risk profile. So thank you. Like, share, subscribe, and comment.